Can you also speak to how institutions and organizations can help support families and create positive experiences for children? Obviously, there are limitations on, with social distancing.
Right, but one of the things thank you for that question of what else we can do, institutions and organizations, to create positive experiences. I think be visible in our support for children. It's interesting, UNICEF has done an online survey of kids, and again, I'm happy to share those data with you. And one of the things that they noted is that kids don't feel that their opinions are asked. Okay, and if we look at the national agenda, do we see children actually mentioned, okay, in our national agenda? So how do we talk about kids all the time and then let them know that we are responding? How do we cooperate at the national level, federal government and states, and say, yeah, you know what? Yeah, this is a tough time, but you know what? All the hospitals are working together, and the federal government, which is in Washington, you may not know that if you're talking to a school-age child, but you say the president and the people we elect are talking to the governors and to the mayors, and we're all saying the same thing. We're going to work together. We've had trouble doing that, and so kids are great observers of our behaviors as adults. They take it in. They see whether we truly mean that we love them and that we support them. We must say explicitly the word children, adolescents, young adults. We must acknowledge that, and we must show that we are cooperating, we are working at one. In this time of crisis, what's the network? What's the health system response to this in an organized way so that resources are allocated well? We are working on that in New York in response to this crisis, but we have low-level crisis at all times. We began with a discussion of inequities. How do you distribute so you do not have this income inequality, right? The income inequality has increased over the last 2 decades, right? Why is that? Is because there isn't equitable allocation of resources. And it's pointed out when we try to come together during crises such as COVID-19, that we must address those fundamental problems all the time. I want to mention one thing before I forget it, because it's something that a parent, Mary Ellen Solomon, who worked with us when we did our response to 9/11 and focused on mental health a lot, on the word resilience, okay? So we talk about resilience, and oftentimes in talking about kids, we say, oh, they're resilient. They'll get over this. That's not the meaning of resilience. Resilience is strength in the face of adversity. It doesn't mean you don't need support. It means that we want to support growth following an insult to your mental health or your physical health. And we must, I never forgot this, because she, again, she as a parent whose husband was killed in 9/11, she speaks publicly about this, taught me, we must understand the traumas we go through, and then how do we support each other individually as families, in our communities, and that our public policies do that, okay? Do not divide us. This issue about Medicaid, Medicare, private insurance. Well, do we have a healthcare system that attends to all? And is it seamless for families? Seamless, however we decide, whether in the current discussions about Medicare for all, or whether it is public option, what is it that we want as an outcome? We want inequities eliminated. We're not all the same, and that's great because we speak different languages, we look different, we have different health needs, etc. But there needs to be a fundamental justice in terms of our opportunities to live healthy lives. That is what this is about. It's accentuated during moments of crisis. but it is something that I hope we understand and we put forth all the time. Equity is ever present in our discussions.